One of the things that sometimes people, when they're referred to me for, is for hematology issues as well. I'm a board-certified hematologist as well as a medical oncologist, and people come to see me, the first thing they think of is that they're going to have cancer. I'm telling them they have cancer, but many times primary care doctors would refer a patient to me for a hematology issue such as general anemia. And we look at anemia, that's a low red blood cell count. The red blood cell is part of the blood makeup that transports oxygen through the body. And when a person has a low red blood cell count, we call that anemia. People can be anemic for many, many different reasons. As a hematologist, that's one of our jobs, is trying to figure out what the cause of it is. We tend to look at the size of the red blood cell because that helps us differentiate the different types, whether it's a small, average or normal size or a large size. People that have a small red cell size typically on average have iron deficiency anemia, which can be related both to dietary iron deficiency, people not getting enough iron in their diet. A lot of times the symptoms they would have with that would be cravings, particularly there's a term called pica where somebody craves ice or starch. And another reason for iron deficiency anemia is if somebody has some chronic blood loss. Sometimes, especially in a patient who's a little bit older, we might worry about a GI blood loss either from an ulcer or possibly even from a colon cancer or polyp as the cause. And so we many times will do a gastroenterology workup as well as looking for a cause for why the patient might be iron deficient. Other causes for a normal cytic or normal size anemia would be, of course, acute blood loss, such as after a surgery or trauma or that kind of thing. That's a little more obvious. Then there's other diseases that can do it where there's a problem in the bone marrow. Most of the red blood cells are made in the bone marrow, and so there can be a process going on in the bone marrow that may be contributing to that. So sometimes we need to do something called a bone marrow biopsy to investigate that. Another cause of a common normocytic anemia is what we call anemia of chronic disease. That's where another disease, such as chronic kidney failure or a lot of chronic autoimmune disorders like lupus, things like that, causes the body to not metabolize iron appropriately, and that leads to a subsequent anemia. The patient's actually not truly iron deficient, but they are not processing the iron normally, absorbing it and processing it in the liver, and so they become anemic. Many times treating the patient's underlying reason, their chronic disease, will help treat the anemia, but also we use medicines in a shot form of what we call erythropoietin that can help stimulate the kidney to produce more of a hormone that helps raise the red blood cell count back up. And then the other cause of large anemia, large cell or macrocytic anemia, is a B12 and folate deficiency. We see that commonly, particularly in patients as they get older. Again, can be dietary related, where they become deficient, and we check those levels in the blood, and if they're low, just supplementing with the B12 either orally or in a shot form many times will reverse that. So those are kind of the main things that we look for. Most of the time it involves doing blood tests, but sometimes also a bone marrow biopsy to look for cause. There are other rare, more serious things that can cause anemias, including problems in the bone marrow like leukemia or myelodysplastic syndrome or multiple myeloma, but those are less common.